A mental health strategy developed by the Canadian Armed Forces is being leveraged for use in Canadian workplaces. In the October 7th issue of Canadian HR Reporter, I look at how the program works and why it's effective outside of a military environment. I recently met up with Suzanne Bailey, the Directorate of Mental Health with the Armed Forces, at an SCN Network event in Toronto. Here's a bit of our conversation about their Road to Mental Readiness program. Why did the Canadian Armed Forces develop a mental health strategy?
There were a number of factors that went into making the decision. One, obviously we'd been in a conflict in Afghanistan for a number of years and recognized that we needed to do as much as we possibly could to help soldiers, sailors, airmen and women mentally prepare for what they might be faced with over there. But we'd also done a survey with Statistics Canada in 2002 on Canadian Forces members, specifically with respect to mental health. And some of the data showed us that while there were a number of people affected by mental health, about 90% of them, of those who may be affected, didn't recognize that they may be affected by a mental health condition or that they could benefit from assistance. So with that information and the conflict in Afghanistan, we realized that we needed to do a better job of highlighting what some of the indicators of a mental health problem might be so that people would recognize in themselves or others when they were beginning to be affected by mental health, and let people know where to seek help, how to get that help, and make it more acceptable for them to get help, as well as teach them how they could support their peers who might be affected by stress and help their peers in the workplace and in their small teams better deal with some of those stressors.
Why do you think the Mental Health Commission of Canada was interested in your program?
So they'd heard that our levels of stigma around mental health and mental illness in the military were quite progressive, especially compared to other militaries and the rest of Canadian society. Some of our surveys have indicated that only about 6% of Canadian Forces members report that they would think less of a buddy or a colleague who was affected by mental health issues. And similar data, of some of our allies and some civilian workplaces shows data, about 30 to 40% of people have stigmatizing attitudes around mental health. So they wanted to know what we've done to change that. And obviously it's not just the mental health education component that's done that, it's a number of factors. But they were interested in how we've managed to, at the same time, teach resilient skills that can increase performance in the short term and mitigate some of the mental health issues in the long term, but also increase mental health literacy so that it becomes okay to talk about mental health, that people have a very simple language, the green, yellow, orange, and red, to talk about something's different about you and I'm concerned and I think you might want to, think about it and do something about it. So how we've managed to make a very simple yet seemingly effective program work in what a lot of people see as sort of a very tough culture, and if it's worked in the Canadian Forces, then how can we learn from that and apply it to other workplaces across Canada that may not have the same types of stressors?
What makes a program developed by the military applicable in Canadian workplaces?
I think because we've kept it very simple. We've focused not on specific illnesses and diagnoses. It's about how we're all affected by mental health, that it's a continuum, so it normalizes that we all go through ups and downs in our lives. It's okay if you recognize it and take the steps you need to early on, you can recover. We've also made it something that is focused on shared responsibility. So the individual has a responsibility to stay healthy and recognize when they start to become a little more unhealthy, but that managers, peers, colleagues have a responsibility, and then there's obviously a responsibility in the healthcare world as well to destigmatize and to provide that care that people need.